Since hanging his shingle in 2003, Dr. George Raymond Williams has helped over 2,000 of his patients from all over the Southeast free themselves of the chronic leg and back pain that inhibited their quality of life. A comprehensive spine surgeon, Dr. Williams and his talented staff work to provide quality, compassionate spine care to all of their patients.
Yeah, the mission of our practice is that to treat all our patients that come with any type of spinal afflictions so that we can restore them back to their pre-injury or pre-functional status, to get them back so they can restore the quality of life that they had before. We go to various training centers in order to make sure that we're staying on the cutting edge so we can give patients the highest quality and the greatest arrangement, if you will, of treatment that there is to offer.
Larry Wilson had grown tired of living with constant back pain. His doctors prescribed all of the tried and true treatments to alleviate the aches, but nothing worked.
I went to my doctor and she diagnosed me with a ruptured disc, and she gave me all types of meds and heating pad and different, told me to elevate my feet, so she recommended me to a spine surgeon.
After exhausting all non-surgical treatment options, Larry chose to have surgery. He trusted the diagnosis of Dr. George Raymond Williams, a skilled spine surgeon located in Opelousas, Louisiana. This minimally invasive lumbar disc replacement is a proven technique which immediately alleviates the pain while dramatically cutting a patient's medical cost and recuperation time.
We treat all aspects of the spine, be it cervical, thoracic, or lumbar, in a pediatric or adult population too. We go both anterior through the front or posterior through the back. And so we're skilled and accomplished, if you will, to be able to so we can address any aspect of any type of spinal disorder that does occur. Mr. Wilson had a degenerative disc or disc injury along with a herniated nucleus pulposus compressing on his nerves, going down and causing his back pain and leg pain. What we did was we took out the disc that was injured, including the disc herniation, put in a prosthetic disc or a brand new disc to maintain his motion, to alleviate his pain, and so he can get a maximum longevity out of his spine as opposed to doing the old gold standard, which would have been a fusion. The procedure itself normally takes about 45 minutes to an hour, and by doing the minimal invasive technique along with doing the prosthetic disc replacement as opposed to a fusion, we're able to diminish the blood loss, increase our operative time. It's obviously less pain and post-operative pain for the patient, but they also get more longevity out of their spine in the future because their stresses are diminished, and it prevents further breakdown of the spine.
Dr. Williams performed surgery on my ruptured disc, and 5 days after he performed surgery on my ruptured disc, he released me from the hospital. The surgery wasn't as complicated as I thought it was going to be. I'm going back to work. I'm back playing with my kids, and I feel great now.
We're getting good feedback. We have overall 93% good to excellent success rate as far as alleviating patients' pain, both radicular as well as axial pain. And so that's obviously our goal and mission. And so as long as the patient's happy and doing well, then we feel we've done our job, and we feel excited about that.
The best part about being pain-free is, I can sleep again. At one time I had to sleep with my legs propped up and a heating pad on my back. Now I don't have to sleep with a heating pad nor my legs propped up. And I can pretty much perform the duties I was doing before I got injured. It was a slow process. He walked me through it. I was kind of nervous at first, but after he explained the procedures with me, I kind of felt more comfortable with him, and he kind of took me in and performed the surgery on me. And I have some sons, and we get out in the yard and play football and different type of sports out there in the yard. I couldn't do that when I had injured my back, but now it's back to me living again.
Ray came here about 4 years ago, and when he came, he brought some much higher level of orthopedic spine expertise because of his recent training. And that and his talent really makes for a good combination. And it's been exciting to work with him because with that combination, he's able to bring this kind of advance here because there's only a select number of surgeons that they're allowed access to this technology.
The opportunity for this hospital to have that type of surgeon who brings those levels of skills and techniques, we always advertise that we're bringing big city medicine to these areas, and certainly with Dr. Williams' capabilities, we have shown we have that capability. Dr. Williams does about 500 cases here a year, and probably about 60% of the work that he does here is the back and spine procedures. So obviously he is very proficient in doing all these, and I think that proficiency certainly shows because of the draw that he has. Not only does he have the outcomes that are important to the hospital, but the comments that we get back from the public are all positive, and therefore that leads them telling other people about it, and word of mouth is always much better than advertising.
The future plans of this practice that we're going to add on other physicians, both other orthopedics, other spine surgeons, as well as neurology too. And we're happy and excited about this because this allowed us to reach a more broader aspect of the patient populace so that we can offer other treatments to patients that they're suffering from various other neurological disorders. What I enjoy the most about the work we do here as a surgeon is that resolving the patient's pain that they came to us originally to be treated for, getting them back into either their job, enjoying their family, and their lifestyles that they enjoyed previously before they were injured.
If you're tired of living with chronic low back and leg pain, contact Dr. George Raymond Williams and get back to living pain-free.